Hello, I'm Mary Harden, the Director of the Cancer and Specialty Care Center here at Community Memorial Health Center. CMH has offered cancer care to our community for over 20 years. We have made special advancements in our cancer care, but bringing radiation therapy is special to our community. As of July 1st, 2012, CMH partnered with VCU Massey Cancer Center to bring cancer care to our community. Today we're going to take a tour of our Radiation Therapy Center, which is currently under construction.
Good afternoon. My name is Ed Brandenburg. I'm Vice President of Professional Services at Community Memorial Health Center here in South Hill, Virginia. I'm standing outside our soon-to-be completed Radiation Therapy Treatment Center. We want to take some time today with the community to give you a brief tour and show you what's going on as we anticipate the opening of this service this summer. We're now standing at the entrance to the Solari Radiation Therapy Center. While the facility will be attached to the building housing CMH's current medical oncology center, the Radiation Therapy Center will have its own separate parking immediately adjacent to the entrance to the facility, which is here behind me. We're now standing in what will be the waiting and registration area for the Solari Radiation Therapy Center. One of the things that Community Memorial Health Center appreciates so much is the huge outpouring of community support we have received for this project. Two of those community citizens, Sylvia and William Solari, who live in the Lake Gaston area, upon hearing of the community's need, made a generous lead gift of $1 million to help in the construction of this project. Immediately to my right is a donor wall which the CMH Foundation will use to recognize their generous contribution to the community. When a patient enters the building, they will be greeted at the reception area by one of the Community Memorial Health Center staff. Immediately to my right is the waiting area where patients and their family members will be able to wait until their appointment time. Once the patient is registered, they will proceed from the waiting area to the treatment area. Immediately behind me is the hall leading to the exam rooms and treatment planning areas where patients will be able to meet with their physician in privacy to discuss their plan of care and their treatment. Immediately to my left is the hallway leading to the vault where the linear accelerator will be. We're now standing inside one of the exam rooms in the medical oncology part of the building. There's 6 exam rooms here. The new radiation therapy area will have 3 exam rooms that are arranged very similar to this. That'll provide privacy for Dr. Gatowski and other physicians when they're seeing our patients to develop treatment plans and plans of care.
Welcome to our construction site. As you can see, we are still under construction, but that won't be much longer. We're opening it within 2 months. We should be ready to roll. I'm Dr. Paul Gatowski. I'm the Radiation Therapy Medical Director. I work jointly with CMH and with VCU Massey Cancer Center. It's a unique collaboration of efforts between 2 great organizations. One thing that's important, since patients will be coming here day after day, sometimes for weeks, is we make it as comfortable as possible. This is one unique area that isn't in most other facilities, in that we have special gowned waiting area. This is an area separate from where all of the other patients, the waiting room and so forth. There's a separate restroom and changing rooms for men and women, so that when patients come in, they can get gowned, they can get treated, and get back home quickly. Here we're inside the vault. This is where all the real action is. The linear accelerator will be installed on that metal base frame that's embedded in the concrete. This circular area is where the table will be that the patient lays on, so that we can position the patient in any position. Machine rotates around in any direction so that we can get the best combination of beams to give the best treatment. One thing you'll note here, it's very quiet in here. One reason is, if you'll look up above, You see that's concrete. This entire room is a combination of 7-foot thick concrete and lead blocks. Obviously the radiation safety for everything outside is very important, and this is one of the key features that allows us to treat patients safely. So if we ever have bad weather, this is a place I'm going to be. This is a control booth area. This is where the staff will be working computers, systems that all connect into the machine underground. There will be a closed circuit television system where we can watch everything that happens inside the treatment room in a two-way intercom system, so that if a patient needs to stop, if they need help, we can hit the stop button and run right into the room. Radiation therapy is a very important part of cancer treatment. Most people see this and think of it as space age, but it really goes back over 100 years that we've been using radiation successfully in treating cancer. It's one component. Surgery, chemotherapy are all important adjuncts. Many times we'll do 2 or even 3 different forms of treatment all at the same time, what we call concurrent therapy. Radiation targets specifically the cancer cells because they're what's growing the fastest. So radiation actually knocks them as they're trying to divide and grow, whereas with normal cells, the body can repair those more efficiently than the cancer cells can.
With this Radiation Therapy Center coming to our community, it will help so many of our patients here. Not only have they had to travel many miles over many weeks, but also the financial hardships to them and their families. By bringing this service here, it will make such a difference to so many in our community.
Well, that concludes our tour. Thank you for joining us this afternoon for a tour of the Solari Radiation Therapy Center. We look forward to you joining us at our grand opening this summer. Thank you.